Okay, guys. Hey, this is Dr. Sean over at Fortis, and we're going over. You just finished week one. See, like right here. Week one is done, which is really good. I'm going to go through a little bit of looking at some of the things. I was looking at the assignments. The assignment looked amazingly great. There were some problems with some people loading some things and getting things kind of like combobulated with their computers or however they're doing it. You might be doing it on your phone. Sometimes you have to reload because the diagram might not show. And note wrap on the diagrams. Some of the diagrams are really not that great. So if you have a book, and you look back at my get an actual book. I don't have one here with me, but you need an actual anatomy book, anatomy and physiology book. Really good. Remember, go to thrift books, go to Abe books, go to cheap textbooks or something like that. Get an outdated one. Get one a couple of years old. It's okay. You haven't evolved that much, so there's nothing new. And what I'd love to see you do is use that as a reference, and that way you breeze through this stuff. You have that reference right in front of you, and the more you use it, the better it'll be because you're going from turning pages, looking for things to there it is, here it is on the screen, etc. So that's really a good thing. Now we did our what is homeostasis was our first real discussion in there. I saw some of those. Let's make sure that your discussion responses, this is important, are more than a few words. If it's like I agree or whatever, I said this a zillion times every term, but I understand it's hard to do this because you're like, okay, you basically answered it, so what the hell am I going to add? Try to find something, either something that they spoke about and somebody else spoke about, and add to it, or say, hey, Rachel's other response was this or something. Something, just put some meat. We need some meat and some gravy in there. It's not just the basic old stuff. I'm looking at right now. It looks like assignment one, basic terms, anatomical terms. Assignment one, there's like six. Oh, anatomical terms, very easy. Oh, not too bad. Distal, proximal. Distal means in the distance. Proximal means proximity alert. Man, something's getting close to us. Lateral, medial. Those are really good to know. You're going to need those. So draw a little poster of them or draw a little diagram and just get those in your head. I know the diagram in here had a little it showed like, oh, this is distal and this is proximal and this is lateral and that's medial and this is superior and inferior and all that kind of stuff. Remember though that even if that body, this is my adjust a monkey, even if this body, okay, this is superior, right? Even if I do this is still superior, not this. This is superior. Way over here. This is anterior. This is posterior. Anterior, posterior, posterior, anterior on my side, anterior, posterior. So I just wanted to really go over just a few things for the first week. It looks really good. I'm really happy with what I'm seeing on these, and there was a couple issues, but you know who you are, but you were not the only one. There was actually multitudes of you, and a few people actually had problems getting the book to load, and that's normal for the first week. But usually the first bugs are out of this whole thing by like Thursday or whatever it was. I guess we started Monday last week, so this is the second week. Ugh, week one's done. I'm doing all the grading tonight, so anything else that needs to be graded will be done. You'll be able to see exactly where you are in the class, which is good. Let me know how you're doing. Read those announcements because I keep putting more announcements up there, and I'm adding little bits as we go. I'll be looking at the discussion boards a little bit more in depth, and I'm going to do a little bit more like interaction on those because that's where I have this place here, the end of week one and done with the adjust a monkey, so we can get things going. You guys have a good one. It's Tuesday here, and hopefully you guys are doing well. I will see you later. This is my office. Here's my chiropractic office that I have. You can see actually the rest of it here if we look around. We've got, there's acupuncture supplies and some supplements, and there's my treatment table, and my little mannequins are right there. I have a skeleton that I use all the time. I mean, I use those a lot. I use those to train patients. My cable's coming loose. I use those to train patients and tell them how things are going. These are like, there's a mirror actually right there. And other computers and things like that in here. It's a nice small place. So anyway, this is Dr. Sean over at Fortis, and it is the end of week 1. You guys are really doing good. Keep going, and let me know if there's any issues whatsoever, because we can address those. So I've been poking around trying to like make sure that things are cool and groovy with, like this is new. You don't have to type a lot of stuff, so you just have to like click and move or click the appropriate answer, which is good. I know it's arduous, and tests your patience at times, but that's the dealio, And this is only 6 weeks, so we're already like getting to be a third of it already over, right? Or 1/6, something like that, whatever it is. Yeah. So take care. We'll talk to you later. Bye.